Hello everyone, welcome to Inconvenient Truths. I'm your host, Jennifer Zeng. The nightmare has started again. That's the sentiment many Chinese netizens are sharing now. Today, let's quickly update you on the epidemic situation in China. First up, the health code system has been officially reinstated in Guangzhou, Guangdong province. Let's check out a video.
市区各级各类医疗机构普通门急诊就诊人员凭健康码绿码通行，新入院住院患者及其陪护人员凭24小时核酸阴性证明办理入院，发热门诊尽可能做到应设尽设，应开尽开，充分发挥前期114家规范化发热门诊的作用，强化发热门诊医务人员配备，优化候诊区设置和就诊流程，对就诊患者开展核酸检测和分级分类诊疗。
This means now in Guangzhou, you need a green health code to enter any hospital. The health code is a mobile app used by the CCP during the 3-year COVID pandemic to control people's movements. If your health code turns red or yellow, you can't go anywhere. But it's not just in Guangzhou. From what we know so far, like Beijing, Sichuan, Fujian, Guangdong, Shanxi, and Zhejiang province are also implementing it. Secondly, some areas have reintroduced COVID testing in public places.
你做核酸了吗？我已经来到广州，准备参加读懂中国国际会议，刚刚完成注册手续，而我要参加。This
video was released on December 1st by Professor Tian Li, director of the Financial Engineering Research Institute at Harbin University of Commerce. He was asked to undergo a COVID test while attending an international conference in Guangzhou. In this video, he says, "I've just arrived in Guangzhou, but the first thing I have to do is a COVID test. They say the results will be out this afternoon, and I hope everything's normal so I can attend the conference smoothly." This post reveals that Shanghai Airport has also started COVID testing. On December 1st, He Xiaopeng, the chairman of Xiaopeng Xpeng Motors, mentioned on Weibo that he was required to undergo immediate COVID testing upon his arrival upon his return to China through Shanghai from abroad, with 2 swabs at once. He was told it was a random check, though it seemed everyone was tested. This Weibo post has since been deleted. Thirdly, more than 10 COVID-19 vaccines have been approved for emergency use in China on December 1st. And this includes the mRNA vaccine for COVID variant Omicron XBB.1.5 produced by Vax, and the COVID bivalent XBB.1.5 plus BQ.1 mRNA vaccine by CSPC 巨石 Biomedicine Cooperation, and the protein vaccine for recombinant COVID variant Beta Omicron BA.1-BQ.1.1-XBB.1 by Sinocell. There are many other vaccines, but I won't list them all here. The fourth update is that CCP's most important mouthpiece, Xinhua News Agency, published a notice from the National Health Commission today. The notice calls for improving healthcare service for respiratory disease during the winter and spring, and exploring all possible resources to provide pediatric diagnostic and treatment service. From this, we know that the situation must be very, very serious. Otherwise, they would not have released such a formal notice. Fifthly, Zhejiang Province Yiwu City, famous for its small commodities, suddenly posted on its official website on December 1st. Advising residents to store for over 10 days of food, and that the food storage in canteens and restaurants should be no less than the average daily consumption of 15 days in the previous year. However, this post has been deleted, and the original page is no longer accessible, though related content is still visible on the website of Yiwu City Commercial Bureau or Grain and Material Reserve Bureau. The sixth piece of news comes from an interview by New Tang Dynasty Television, reporting that a hospital in Wuhu City, Anhui Province, has a 10% rate of COVID-induced white lung infections, with some children experiencing severe white lung and even death. Recently, multiple schools have issued notices to stop classes. Additionally, there are reports on rising death tolls in various places due to the epidemic, but authorities are suppressing this information. Someone in China said, "We are now back to the situation we had at the beginning of 2020. The death toll is rising, affecting people of all ages." Well, that's the latest since my last report on this outbreak. Considering the resumption of COVID testing and the emergency approval of various vaccines, it seems this wave is primarily COVID-related, potentially with new variant, rather than the previously claimed Mycoplasma pneumonia. Clearly, the outbreak is significant, forcing officials to suppress information while urgently implementing testing and control measures. Well, that's all for today's update. Please follow my account on X, subscribe to my channel on Ganjin World, or become a member on my website, jenniferzengblog.com, or make a donation. In these rapid changing times, I hope we can stay connected through these relatively free platforms. Thank you. See you soon.